All right, well, I'm a physical therapist. I've been practicing for about 25 years in the area, and over the years I've just noticed a lot of, I guess, the issues that I work on the most. And so I'm finding myself kind of creating small little just routines that I like to put together just to address the major issues. And so posture is one of them, and neck posture really ties in. And so, you know, I'm going to kind of make this a little bit of an interactive class, if you don't mind. You know, I don't know if it's not video, it's just being recorded. So, as far as like a postural adjustment or an alignment in a sense. And so, how about we start there, and then I'll just do one at a time. Come on up to the wall here. And just stand with your back to the wall, just like this. Okay, so this is, you bring your feet back just a little bit, and then away from the wall about half an inch. There you go. And now, can you bring your head straight back? All right, now notice how we're looking up. Can you bring your chin down a little? And you notice how it pulls your head away. Okay. So that is showing what we call forward head posture. And then I'll take a look at you in a moment too. And I tell you what, when I learned this postural assessment in school, and I brought my head back like that, it was like I was choking, you know, because I was so used to being forward head, because I was 30 by the time I went back to college. And so I had a few years under my belt for neck posture. And so with that, then that's the first thing. And then kind of squeezing the shoulders back, and then this was pretty good. A lot of people will have a big curve in the back, and I can get my whole hand back there. And so with you, I would say that this class is going to help with just reducing any ongoing potential problems in the head, because most of it is because the head comes forward, and I'll explain what's going on. Okay, your turn. Yeah, and that's exactly true, because as the head comes forward, then instead of looking at the ground, we crank it up like that, and then you tighten up those muscles in the back. Okay, so we're back to the wall, and you go like that. There you go. So, see, now that's not too bad. Does it feel kind of awkward to you?
Go ahead.
Yep. And so your chin is up just a little, but not too bad. So there you go. And then as you do that, as you play with that, and you start to feel a little stretch right back here at the base of the skull. And that's a good thing. And so then shoulders back, and I'm just going to take my hand. Now see, you've got just a little bit more there. So if you kind of tighten the tummy and roll your pelvis back, that will decrease the curve in the low back a little bit. And then that's pretty much what your standard would be for the alignment. And then you just relax into it. Okay. So we don't want to stand at attention, the old military attention. We want to just get in there and almost at ease. You just line up and then you relax. But the key to practice then is what you can see is just gently drawing your ears back over the shoulders. Okay, so I do it often when I'm driving and push my head back into the headrest. And now I'm even noticing that I've been in some newer vehicles. I think my sister it's been a while since I've been in hers, but she's got a new, relatively new Highlander. And I noticed that the headrests now are tilted forward, and that perpetuates. I mean, it's probably safety because they're looking at the average of how far your head is away, and so they try to match it, but they used to be adjustable, and now they're not so much. So if that's the case, I highly recommend getting some kind of a pillow or some kind of a mat to put behind your back so it brings you away so you can still get your head back when you're driving. Because driving is one of those areas that I find, even myself, I oftentimes wear, especially in the summertime, wear a wide brim hat. And one of them I have kind of just folds back. It's loose enough, I can just push my head back in there. It's kind of my raggedy hat. But some of them have more of a stiff brim. And if I try to get that head, or I catch myself, the rim is pushing me out, so I'll take the hat out so I can get my head back.
For Highlander, probably has a lower lumbar thing that you can just need to go with just adjust it.
Yeah, they have. That'll bring your back out, and get you back. So that chin tuck, we call it the chin tuck or cervical retraction, is really the one go-to move that I really encourage people to play with all the time. And that's really, now we can get into a little bit of the mechanics. We can take a look at the sheet here. What I put in here is, in our bodies, we're just full of receptors. And so the nerve receptors, free nerve endings, Purkinje corpuscles, Meissner corpuscles, spindles, Golgi tendon organs, everything is like censored, like vehicles nowadays. I relate to vehicles a lot because I was kind of a mechanical guy, and that's why I'm a PT now. But the sensors are in here telling us temperature, telling us pressure, telling us when something is stinging, burning, itching, all that stuff. But we've been kind of conditioned to blow past that and ignore it. And if we have pain, we've been also kind of conditioned to cover that up with medication or something, or the old no pain, no gain, suck it up, just get over it. And pain's really our check engine light. So as soon as you feel tension or discomfort in the back of the head or something, there's the first indicator to respond with a slight retraction. And then as you do that, you'll start to notice that the check engine light will start to go out. Okay, it's when we ignore these things that we start to have bigger issues. And so some of the main issues that we see in the neck are the discs. You know, people get cervical discs issues down in here in the mid-spine area. And then you see, as we get older, sometimes you see that lump and a bump at the back of the neck there. That's like a low-grade swelling. And then you also get the headaches. Okay, so when the head is, like I was mentioning here, forward, what it does is it starts to bend right here at the junction where the ribs meet that T1. And so we start to hinge on that spot there, and that puts a lot of stress through the discs in the back here, and then the interspinous ligaments and muscles that go between. So in this example here, you can see in between each of the vertebrae, it's just filled with muscle. And I don't know if you've ever been a deer hunter or did any butchering or anything, you try to cut the back strap out of an animal, and I mean, you can't really get down to this nice clean bone. It's so filled with muscle that we don't even realize how many muscles really got to do with motion. And so when your head comes forward, this spot right here, we start to hinge on that. And then like what I was mentioning earlier, as the head comes forward, then we look up like this, and now we lose some of the motion that occurs in the back of the neck. So mechanically, when you look at the skull here, the skull has these two little condyles, and then this is the hole, the framus magnum that the spinal cord runs down. Okay, now the condyles of the skull sit in a pigeon-toed saddle of the top cervical vertebrae here. Okay, so 50% of our nodding actually comes from that rocking motion that occurs at that joint. Now again, if your head is forward, you do this, now you're taking up the slack and you're using and tightening the 8 little suboccipital muscles that connect the skull and move the skull with C1 and C2. And so those muscles can start to get tight and spasm because they're holding your head like this to look straight ahead. And then on the next joint from C1 to C2, you can see it's kind of a big, almost like a shed roof, and 50% of our rotation then occurs from that position there. And again, when the head comes forward, you're doing this, and now you lock up those joints a lot sooner than when your neck and your head is aligned. Okay? And then it switches completely from that big shed roof joint to smaller. They start to slope backwards, and then they get steeper and steeper until they're almost completely vertical in the mid-back area. And then as you come down the spine to the low back, they change direction again and they promote more flexion. So in the low back, we get our flexion and extension. Mid-back, we get a lot of the rotation. And then you get a blend in through the neck, which gives us the Gumby effect through the neck. Okay? So what happens then is, as these muscles are tightening from holding our 8 to 12 pound head up, for every inch that your ear is forward of the shoulders, you add 15 to 30 pounds of tension to those muscles. And so it's like holding a bowling ball up out here. Now when you get the head back, it's supported by the spinal structure and it balances and it supports itself. And so there isn't a lot of muscle activation and energy that's going on here because they're all kind of working together rather than just hanging on the back strap of the neck. Okay? So that's why I really get into the postural part about it, because that's the one thing that we kind of take for granted. In gravity, everything we do, and now with cell phones and computers and all the stuff that we're doing, looking down like this, we're just in this position a lot. So if you do that and you practice your chin tuck and you work on your upper nodding, you can still look at your phone and be in this position versus in this position and hanging on the structures back there and increasing the tension through the muscles. Okay? So, there's, have you ever heard of the principle of reciprocal inhibition? All right. Well, it just simply means that if I tighten my bicep, it turns on. The tricep turns off. Okay? So it shuts off the opposite. And that's just a natural movement that we have. So now watch what happens to the bicep. So biceps on, and now I'm going to push in, boom. See that bicep drop off because the tricep turned on to extend my elbow against my resistance. And then the bicep shut off. So what happens in the spine then is that because we use these muscles all the time by default, there's a pair of muscles that are on the front of the spine here that we call the very deep neck flexors. And so when these muscles are turned on, guess what? Those ones will get inhibited, okay? There's longus coli and longus capitis, and they're right on the front of the spine. And so those are the muscles like the six-pack that we'll talk about in the spine part and the back part. But those muscles then would be your nodding muscles for the neck. And when they get weak, we start to compensate and use this big muscle right here that we call the sternocleidomastoid that attaches here, and it attaches on the sternum and on the clavicle right here. And so both of those muscles come up. And so when you lean back, you can actually feel them. So go ahead and just lay your head back. Put your fingers right on those muscles, and you feel how they kind of just pop out at you right here, right on the side of the neck. Okay? Then if you come forward, you feel them shut off because now the back neck muscles are on. And now when you bring your head back, you'll feel those ones kick in. Those ones start to compensate for the weakness in the deep muscles. And then we start to use those when we're getting out of bed, when we're getting out of a chair or a recliner, or just moving forward. So now they start to pull and they start to create more of that hinge action down in this lower cervical region right here. And then they take over for the neck muscles and they just start to get weaker. So I don't know if you've ever heard now in chiropractic and x-rays of the spine, a lot of times when they take an x-ray of the spine, a person might hear that they've got a straight neck, the spine's straight, they've lost the curvature. And I've pondered that for some time, and what I believe is occurring is that, again, because these muscles get so tight here, and you don't have any muscle strength on the front, the muscles back here start to pull on all of their insertion points on the spine. And so instead of having a nice C curve here, which is part of your shock absorption, we get our cervical lordosis, our thoracic kyphosis, and then the lumbar lordosis. So this curvature is normal, but that tension pulls, and then it just straightens out that spine. So as you start to work on increasing the strength of the muscles in the front of the neck, then that will start to restore the curve a little bit and normalize the structure a little bit more. So the best way to play around with doing those, strengthening that muscle, is that little nod that I had you do when you had your head against the wall there, and I told you to just bring the chin down. So as you practice that, if you line up your head, you get it in that neutral position, and then you just gently do a slight little chin nod, you start turning those on. And you can actually even play around with putting your fingers on there and do that without firing those sternocleidomastoid muscles that you turn on when you go back. Okay? And you can play around with this. It's the best teacher is when you get home tonight, put your fingers on there and then lift your head up, and you'll see how fast and immediate those muscles take over. And then with time, you just practice doing your nodding without using those muscles to do it for you. Now, one morning I was sitting and I've been practicing this for some time, and I was sitting on the couch and I think I had a slight headache. And that's what I'll do oftentimes if I start to get a slight headache. This spot right here is C2. It's the second cervical vertebrae, and these little muscles actually attach right there. And so what happens oftentimes because of this position and this is that, again, these muscles are tight, there's tension through the extensor muscles in the back, and that little pigeon-toed saddle, the head starts to slide into it, and the condyles will kind of compress. They kind of wedge in there. And so in craniosacral therapy, there's a technique that we use where we get the fingers right up underneath here and then just support the head and the neck until the head and everything starts to drop back. And that's unloading that section right there. So the weight of the head with the fingertips under there, and you can actually do that a little bit with making a little fist and just let your head relax back in there, but that helps to unload it. But the headache snag that I used, I was taught by a New Zealand physiotherapist, is you find that little knob, you put one finger on there for a marker, put the other finger over the top, and this is now C2. It's the first cervical vertebrae that you can feel. C1 is in that little divot that's right up on top here between the skull and C2. So you put your finger on C1, or C2 I should say, and you can do one of two things. You can press on it and see if that changes your headache. And if it does, then you just release it and then just oscillate it gently for about a minute. Secondly, you can just stabilize C2 and use your chin, that retraction I was showing you, to just move your head back over C2. Okay, so if you notice, I'm just holding steady, and then I'm just bringing my head back over. Okay? Either way, you're jiggling and wiggling and moving and unloading that section, and it can take a headache away almost instantly. I just did it, it was this morning. Yeah, one of my clients this morning, I was working on something else, and just mentioned that I was starting to get a little migraine, and she didn't have her medication with, and I said, oh really, can I try a little something? And she was already on her back, so I just got up underneath there and I put each finger on her, and I was explaining what I'm doing, and I pressed and held, and I said, does that feel a little better? She says, yeah. And so I did that, and then showed her how to do that, and it dropped it by 50% right there. And I told her to do that, some more during the day. So, see, these are the simple little things that if you just play with them and try them, you start to see how fast they really work. And that's why I put these classes together, because That's the stuff that I'm using all the time. So the chin tuck is the number one. Get that head back and just practice that. And you're going to do it 100 times a day because gravity, next thing you know, you're out here, I'm driving down the road and I'm looking at traffic like in the, looking, okay, what's up there? And okay, get the head back. I mean, it's just a constant because it's no different than bending your elbow. And that's where the sensory system comes in because pretty soon, you'll start to realize and sense when you're out here. You just feel that little bit of tension and it's just whoop, stack her back up. Now I say stack because there's two things that can happen. When your head's forward like this and you just bring it back like a gooseneck, you see how my voice is changing because I'm virtually collapsing the spine. And instead of stacking the vertebrae, I'm just crunching it down, all right? And so when I say stack, you just imagine like a string on the top of your head and you just stack it back and your voice should change and there's your alignment. Now that leads me to the other thing that I do and I've showed people a lot. Have you seen any of those like cervical traction units where you can put it around your neck and you can pump them up or the old ones had a water bag and you put that string around it. Yeah. Those things they work, but I've never really been a fan of those ones. So, what I do is I take my thumbs and I just come right up underneath the cheekbones here, okay? So you hook the cheekbones on. Let's try that one. And you just hook the cheekbones and then wrap your fingers around your head and hook the base of your skull. And now gently just kind of lift like you're lifting a bowling ball. Now feel how that just unloads a little bit. So you don't have to push too hard and you can kind of get used to it. But again, you bring your head back, you hook the cheekbones, and then you just kind of lift up. And then you can even do a little bit of that nodding just to loosen things up. But what you're doing there is you're basically unloading the pressure, the weight of the head, off of the facet joints and off of the discs. And the tension in the muscles work like ratchet straps. Have you ever seen, I can show you this little picture here. I'll pass this one around for you, a couple of them here, but, all right. So this here is out of my Anat book, Anat Phys book from college. And at that time, I was using ratchets, but you see here, the muscle itself is made up of these bundles, and the bundles are all wrapped in fascia. And fascia is the connective tissue. I kind of think of it like the cellophane or shrink wrap that encompasses everything. That's what holds our skin on. It holds everything in place. And so that fascial system is everywhere in our body. And so it wraps around these what we call fascicles or bundles, the bundles of fibers, and here's fascia wrapping around these fibers that are a bundle of filaments, and then the filaments here are made up of two myofilaments, actin and myosin. And the actin is a twisted double fiber, and then the myosin reminds me of like a little double-ended bottle brush. And again, I'll pass this around for a little closer look. But what you see here then is an overlapping section, and that's what we call a sarcomere. Under microscope, that's a microscopic view of all those little sarcomeres, okay? And so all of those sarcomeres then, I'll kind of pass that around, and you can see all the zones and lines. There's symmetry in there that is just amazing. So instead of 3 myosin, there's actually 7 myosin pods that are held in their symmetry by cross bridges, and then they are surrounded by 6 actin fibers held in their symmetry by this Z line. And they're just chains and chains and links of that. And so what they do is, this is what a muscle looks like again, and that's what it looks like when it's smeared, and that's what a strained muscle looks like under microscope. So what those do then essentially is that the myosin pods actually, in that one fiber, in the fiber that's wrapped in fascia, you'll see like this plumbing system there, that sarcoplasmic reticulum, that releases calcium. Calcium's released from that when a signal comes down the nerve from the neck into a particular muscle to turn the muscle on. So right now, my intention to bend my elbow has sent the signal, and it's releasing calcium from that sarcoplasmic reticulum in the fibers that then connect on sites on the actin fiber, energize it, and then when it energizes it, it twists up and it actually attracts and connects the myosin pod that then bends, releases, connects, bends, and releases like little ratchet straps. So when I was, like I say, in college for this, well, it's 30 years ago now. So it was 90. I bet you I was in that class in the mid-90s. And it was, I thought of it as a ratchet, but now with the advent of the ratchet straps, as popular as they are, I mean, we're constant, that's what it is. So every time we tighten a muscle, its ratchet strap is short, all right? Now here's where that reciprocal inhibition comes in too. So as I shorten this muscle, the brain has shut off my tricep. Now my tricep is gently getting stretched out just to this length right now, all right? It's not fully stretched out, and that's where sometimes we run into problems, especially in the neck and stuff. And then when I get into the lower extremities, I can show you. But a sneak preview would be that this muscle in the front of the quad oftentimes doesn't get effectively stretched, and that's what leads to patellar knee pain, because it puts too much pressure through that kneecap. So the same thing is occurring in the neck here. So what happens then is these muscles get so tight, they're cranking up the ratchet strap, holding your head, moving it around all day long, and you're only going within this range. If we don't go into some functional stretches throughout the day and release that strap, then it starts to bind down, and that's what creates more and more pressure on the joints and on the discs, and they don't get a chance to, like sponges, absorb the water that we absorb during the night. So discs and cartilage, or the cartilage, discs and cartilage are what we call hydrophilic. They absorb water through the night while we're sleeping. That's our restoration phase. And they puff up, and then during the day, squish, squish, squish. We squish it all out, and that's what starts to cause that dehydration. So that's why it's important to drink water too. I mean, Stacy's always on me, drink water, because I'm just a dry guy and I always forget. I just don't think of it. And I, try to carry a bottle, but so anyways, that's what is happening with the discs, and the more dry and beat up they get without replenishing, that's when they start to break down. And then when the fibers that contain the nucleus in the center start to fray, like the knees of your jeans, where do they start to wear out? Usually in the knee or right around the pocket or someplace there where the fibers are always being bent. And that's what's happening in the low back and in the neck and stuff. So those fibers start to fray, and now the jelly under pressure, like a jelly donut, starts to pooch out and compress and push on that. Now you've got your disc bulge, and then that disc bulge, this disc bulge fell off, but the disc bulge then will start to push out into the canal, and then that may or may not press on a nerve, or it may press on the spinal cord itself, and then you start to have your sensory system problems, tingling, numbness, and tingling, which again is your check engine. Because most of the time, if a disc starts to bulge, or you're in a position that's pinching on it, you're going to get that little zinger, and if we just ignore it, then it could get worse. But if we change our position and we kind of think about it, maybe you start noticing that it's happening more often, then I would really step up doing your little tractions and the stretches to start releasing some of the tension. Okay? So, the stretches, let's see, how are you doing so far? Am I throwing a little bit too fast? Okay, all right, because If you have any questions, feel free to ask. But what I'm finding then, there's three major stretches that really affect most of the muscles of the neck. And so when you start with your positioning, you get your head back, now your spine's aligned. The side bending stretch starts to stretch these little muscles on the side that we call the scalenes that attach onto the ribs and onto the vertebrae. And so they're coming off of the ribs and at the top two ribs, and they actually function all the time, lifting and lowering the ribs like bucket handles as we inhale. So when we inhale, take a deep breath, and actually put your hands right up here so you can kind of feel what happens. But when you inhale, can you feel a little bit of a movement in the top of the shoulders up there? Yeah, so you can see your hands rising. And that's what's happening is we inhale these scalene muscles that are deep underneath this platysma and the sternocleidomastoid. They're hooked on those top two ribs, and they raise them up to expand the lungs. And then when we exhale, they just relax and the ribs come back down. And so this is going on every breath we take. They also work with moving the neck a little bit because of their attachment. And so when these start to get tight, they'll shrink up, like I was talking about that saran wrap and the connective tissue. When the head's forward, this will start to adaptively shorten because it doesn't get stressed enough to be lengthened. And so then it makes it a little bit harder to bring that head back. So when I was looking at you, there's a little bit of that there that if you keep practicing that, and I'm going to show you the stretch for that now, that you'll be able to start loosening that up and start to restore a little bit of motion more and more, and then pretty soon you'll be able to get that head back there without an issue, okay? So, but it's consistency, okay? Just like everything, it has to be done consistently. So to stretch that, you start with a side bending stretch, and then if you gently reach up and you hook your fingers underneath the collarbone, you'll hook the top two ribs. They come in right there. This is your AC joint, your SC joint, sternum, clavicle, sternoclavicular joint. And the first rib is attaching right below it, and then the second rib is below that. So if you drop off, you can kind of hook those ribs. And now all you're doing is you're anchoring the rib a bit. And then with your jaw relaxed to relax this platysma, you just look up and away, and you'll feel a nice little gentle stretch. A stretch should not be painful. It should just feel like a nice little pull on that tissue. And so you can, you see all I'm doing is I'm kind of hooking the fingertips a little bit and then just pulling down and anchoring and then adjusting the intensity of the stretch by my head and position, okay? And you notice that I'm looking around because I'm changing the angle to see if I can find the right ray that is the most tight. And that's what you're going to kind of hold there. So stretch 20 to 30 seconds. That ratchet strap picture, that's what you're really working on. You're working on just allowing those fibers to gently be pulled apart rather than be kind of stuck in their bunched connected position, okay? So that's the big one. That's a good one because what happens here too is that when these muscles get tight, some of these, this is what we call the brachial plexus. This is the nerve system that comes out of the spine, and as you can see, it's kind of a little net. And they merge and they divide and they merge and they form three main nerves that run through your armpit. The median nerve runs down into your palm here and innervates this part of your hand and in here. The funny bone nerve is your ulnar nerve. That runs right down here and it innervates the baby finger and half of your ring finger. And then the radial nerve kind of comes around the outside of the arm and down through the elbow on the outside of the elbow, and it innervates the whole top of your forearm and then the top of your hand. Okay? Then there's two short ones, axillary and musculoskeletal, that kind of come up and innervate into the deltoid and the upper muscles here a little bit. But if you feel tingling in any of your fingers, that's something to pay attention to, and that's what I would look at. Some gentle stretching through the neck and the shoulder to release any tension on the nerves that are coming through them, okay? And so, but the nerves, then the lower nerves coming out of C8 and C7 can sometimes come up and over that rib. So the rib is here, and if the rib is pulled up by the scalene muscles, it can cause tension on the nerve then that's running down into the arm and create numbness and tingling. So that's fixable. All you have to do is hook your rib, give yourself a gentle stretch, and start releasing the tension in those scalene muscles to allow the rib to fully relax down and stop hanging up and pulling up on the nerve, okay? It doesn't happen a lot, but it can happen, and it's stuff that I've treated in the past. And so again, a simple regular stretch routine where you're just gently stretching those muscles and loosening it up, and continue to work with your retractions, because as you do your retractions, you're pulling functionally and releasing some of that tension that way too, okay? So that's the one, and you just start that head back, side bend, kind of hold those ribs down, and then look up. You can look toward or away, but just feel a gentle stretch, and then you go to the other side, okay? All right. Now, the two that are most effective for the rest of the neck back here are the upper trap stretch and the sternocleidomastoid. So the upper trapezius is the big flank, or the big muscle. It's a big muscle that comes down across the back, and actually is kind of right in this picture, I bet you. Yeah. You can kind of see parts of it in this picture here. It comes off the back of the neck and down. And let's just see if I might have a bigger picture here. But that muscle it attaches right on the base of the skull, right up in here. Okay, so it overlies these suboccipital muscles, and it attaches here, and then some of the fibers wrap right around and attach on the outer third of the clavicle, the collarbone. And then the rest of them, you can kind of see that and feel that contour as it comes up. The rest of it comes down mid-back, and it actually will come all the way down to here. So lower fibers run up, middle fibers bring your shoulder blades together, and these upper fibers help to elevate the shoulders, but they also turn the neck, okay? So because they're attached here, when you bring your head back, and you side bend it, and now you look toward the side you're stretching, you're now wrapping those fibers right around your neck, and just you can feel a nice little gentle stretch on that, okay? So let's see, now, yes, do you feel the difference? Okay, because when you were looking this way, you were kind of looking down, and now that's a good stretch for the next muscle group, but when you went back this way, I can feel how it changes. Now you start pulling on that upper trapezius. There you go, just like that. You feel that in there? Yeah, that's it. And that muscle gets tight all the time. I mean, if you're doing shrugs or you're carrying stuff, I mean, Stacy and I, we heat with some firewood and stuff, so I've been carrying firewood and all that, but you know, carrying groceries, we do a lot of this motion, and so those muscles then start cranking up, and if they're not getting stretched, they're putting that ratchet strap coil spring compressor on your spine, and now you're compressing the discs, and you're compressing the spaces that these nerve roots are coming out in between the vertebrae. There's a little foramen, and when they talk about spinal stenosis, this is one of the areas that gets stenosed. The opening starts to narrow down because of a lot of stress and strain in the tissue around there, and inflammation, and it's trying to heal itself and reinforce itself, so it gets thicker and thicker and thicker, and then pretty soon you only got a little opening for that nerve to go, so anytime you move, you're starting to get stuff going down the arms. And then that's the stuff that gets a little bit harder to take care of. So what I'm talking about now is being able to minimize that kind of stress on the tissue so that that doesn't happen. Because I treat that a lot, and that's a lot harder to treat because now you've got structural change that takes a lot longer to go away than it does to form. Because think of a stalactite, you know, I mean, it's just that slow process. And that's basically what spurs are. All of these are spurs, but these are formed as part of the developmental structure. The spurs that we get in the shoulder, in the vertebrae, in the neck, in the heel, other places, or in the spine. Sometimes people will develop spurs in the spine, and then when they move, that spur is poking into the nerve and it's sending signals and numbness and tingling, see? So the spurs are formed by that tendon pulling on the skin of the bone, which is a two-membrane layer. So you can see I've got two layers right here. This is connective tissue similar to the tendon, and then this layer here is a layer of bone-producing cells, and they're called osteoblasts. So if that's on there and it pulls long enough, it starts to lift that skin away from the bone, and now that underlayment says, oh, we got work to do, there's a space to fill, and it starts laying down bone to reinforce and heal, and now you start to develop a bone spur. And a lot of times they occur in the shoulder, and then like I say, I've seen them, you know, x-ray reports and stuff where they talk about the spurs in the spine and a lot down in the bottom, but that's the kind of stuff that occurs because we don't really pay attention to the tension that's developing in the muscles that we have some control over, okay? So going back, that's why this is a very effective little tool, even if you don't have a headache, even if you don't have any pain, but just to gently unload. And so for the low back, it's just a little one, something where you just hang off the edge of the counter, or a pull-up bar, or in between some chairs. I mean, anything just to kind of unload that spine and open things up a little bit. Okay, so now we'll go back to the neck here with that upper trapezius. I had you going this way. The next muscle is called the levator scapula, and that attaches right here on the corner of the shoulder blade, and it comes up and it attaches on the side of the vertebrae right out here, okay? And now that elevates the scapula, and because it's on the same side and it's attaching here, you do the same stretch, side bending away, but this time instead of looking toward that side, you look away. And so it's just that simple. You look away, and now you're wrapping that muscle up and around the neck and releasing some of that tension in there, okay? So that's what you were doing, yeah, when you went the other way in the other one. So, but that's it. You want to play with it because you will feel, and it took me a while to really get these two down when I first learned them years ago, because I was always confused. Which way do you rotate the head? But it really just simplify it. You bring your head back, you side bend, you look one way for 20 to 30 seconds, feel what that feels like, and then just turn your head the other way, and now you'll feel a change, wrap around a little differently, and you hold that for 20 to 30 seconds. You know, and if you do that to begin with, that the 20 to 30 second hold is enough time to allow that tissue to pull apart. And so once you start increasing the length and the flexibility, it responds a lot faster. So you don't have to hold every single stretch for 20 to 30 seconds. You might catch yourself and just do a quick 15 second, 10, 15 second stretch. I mean, it's still lengthening the muscle because your intention is to pull that muscle gently apart. So the chin tuck gets your cervical alignment, puts you into cervical alignment supported by the spine. Then if you hook your ribs and look up and away or toward whichever direction you need to, you'll feel the nice stretch through those scalene muscles, the scalenii. Okay? And then if you want to stay on the same side, just bend your head a little more to the side, look toward that side, feel the stretch in the upper trap, turn the head, feel the stretch in the levator scapula, and then just repeat on the other side. Now, the last one that I really like to play around with too is as you get good with doing your chin knot, and you play with that, two things you can do with that. One is you can continue to gently roll your chin into your throat like a fruit roll-up or a party favor. Okay? And then you just gently unroll it. So as you do that now, you'll start to feel, and you get a pull on these extensor muscles, which actually go all the way down and connect into the ribs. I was hoping, these muscles, they come off of the base of the skull, and they come down and they attach onto the ribs and the spine here, and then interdigitate with the erector spinae that come up from the back. So right in this mid-back area, the muscles kind of do this sort of thing. And then a few of the strands, actually, I've seen some pictures where the strands come all the way up from the sacrum right up to the base of the head. So I mean, some of them, and that's the other thing about I've done my fair share of deer hunting, and when I'm successful, that's my anatomy lesson, and looking at how those layers merge into one another. I mean, they're tough. It's tough tissue, and so that's why we can do all the things we do, and yet, if we don't pay attention to how that tension's building, then it starts to work against us. So now, the second thing that I do with the neck is you play with this one. Now, when you do this, if you feel any type of dizziness or feel lightheaded, back out. Don't go into it for a bit, because it's easy and potential to, these are your vertebral arteries. They run up through little holes in the side of the vertebrae. And if you've been in a position and for too long and you start to get some age-related changes in there, it is possible to pinch that artery off and cut blood flow to the head. Okay, and so that happens when you do this too much, if it's vulnerable. I mean, that it's not happening to me, and it's never happened to me that I've noticed. But I'm just saying, when you start to play with some of the high cervical, just pay attention to that, and then do some of the other stretches a little bit first, and then work into it so that you don't pass out, right? Because that's not good when you get a head injury. But the exercise then that I was referring to then, that I was playing with on the couch one morning, was as I was working on this knot, I started to realize, I can use my head for a weight and resistance. And so I just slowly worked into just going back and then slowly bringing it back. So just slowly, and not kicking in the sternocleidomastoid muscle. See, when I bring my head way back, here they are sticking out there. If I just play around with just using my head as a weight and think of just using those deep neck flexors, now I can start to add resistance to those and start strengthening them. Okay? Another way is isometric, but this one's a little more challenging. You keep your head back and you're just doing a slight nod into it, but that one's easy to overdo and then turn on the sternocleidomastoid. So I always I try to keep it simple, just nice and simple, where you can push into it, but you're doing more of a nod versus a push forward. Okay? Isometrics are nice. You can play with those. It's a nice strengthening activity, and for the neck muscles, especially if you start to notice some weaknesses that you need to work on. But again, we tend to use them a lot, and so the first thing I go to is the stretching. And then if you feel like I'm kind of a bobblehead, then you can kind of work on some of these different, you can turn any one of these into an exercise. So even this rolling down and rolling up, you just start doing a few repetitions of that, and now I'm exercising these extensor muscles, in a functional roll. Just like when you go backward, you can pull them forward. All right? So, that is let's see what we got here. That's the most, as most of the stuff. If you take a look at the handout, I put most of this stuff in here. And you can see then in that picture of the forward head posture and those muscles in the back, it says erectus capitis and stuff. You can see how it affects those muscles. And then in this picture, that's a nice little picture then of those extensor muscles in the back of the neck. And then this here is deep muscle too, so that the upper trapezius is actually partially missing here because it's showing the deeper muscles. That's the one that looks like a cape that comes up and comes down from the bottom of the head. So, that's why I say here posture. You see, I start right out with posture. Alignment is everything. And how do you know when you're out of alignment? Your sensory system. You start to feel tension. You start to feel discomfort. You might feel tingling. You might feel some burning. Those are some of the symptoms that you can feel when well, look at what happens when you hit your funny bone. It goes right down to the baby finger and it kind of zings there for a minute. Or, sometimes there's been one time I was mountain biking and I was on this trail and I'd gone up the trail and this branch was hanging down and it was like one of those boardwalks, and coming back down I totally spaced it and I was looking down to come off of that thing, and that tree branch hit me right on the top of the helmet. Luckily I had a helmet on, and it just went bam, and I heard cracking, and I fell off my bike there, and I just got up and I thought, okay, all right, yep, all right, everything's moving. But it was just that instantaneous, like when you hit your head coming out of the basement or something. It's just that crunch, and you hear the crunching sound, and I know what can happen. And so it's like, okay, and those are the cases then where I might do a little bit of the traction. I hadn't been really doing this. I probably did though, because again, in that situation, as long as I didn't feel any numbness and tingling and everything was moving, I just started to do some gentle stretches until I was, felt confident that nothing had happened, But it's that unloading. I do that a lot because of just what I've explained now with the discs and stuff. And then your gentle range of motion, all that stuff. So it's just one of the things that I'm finding that if you just start paying attention to those little signals in the body, you can really put out a lot of fires before they get really bad, and put off surgeries, etc. Because even with a surgery, I've worked with surgical patients, and many have done well, and there's been many that have gotten worse because of it. And so, that whole situation, you don't really know until you go through it how it's all going to turn out. And so for me, I look at this as just trying to share an ounce of prevention, and so you can save that pound of cure, because it's just a little bit. Yes, sir.
So, for this, that ends up being what we would often see with like somebody like having a monitor in front of them all the time. But you were just talking about biking, where often it's a matter of then you're put in a position where you're leaning forward over the handlebars.
Yes.
But it ends up being a matter of you're pulling your head up, but it's not so much, it's a matter of not sticking your head out in this type of position.
Right.
It's more like pulling and really tightening down back here.
Yeah.
Now that's not this position, right?
No, it would be more like this position. Yeah.
But not sticking your head forward so much as opposed to pulling your...
Oh, well, yes, because if we're in alignment here and you're still, I can still get my head back there, but you notice how my voice is changing because I've already got the extension going. And so that does, the first rides of the year tend to make the neck a little bit stiff, all right? But then over time...
And also then tightens those muscles and makes them shorter.
Yes, so when you get off and you're taking your break, then that's where you do your chin tuck and you're doing a little bit of a chin roll. See, so this is how you apply the stretching that you practice into functional application. Okay? So anytime you're caught in a situation where you have to be in that position and now you're out of that position, then you pull out your tools from the toolbox, which are going to be a nice ear retraction, the chin roll, try to loosen those suboccipitals up that have been tightened up, holding your head in this position while you're bouncing around on the trail and stuff. And then maybe even a little bit of the traction just to unload the discs and stuff. So, it only takes just a couple seconds to decompress the neck.
If you're going for a 2-hour bike ride, a couple seconds of this should be enough to.
It can be. If you start to feel pain in there, then I would go a little bit longer. Because again, I would talk about how long can you really hold it, because your triceps kind of start to fatigue if you're giving yourself a nice little pull. So just hold it till that gets tired and give yourself a break. Maybe do some range of motion, just get things moving, and then do another little round. And then as you roll your chin into your throat, like the fruit roll up, now you're opening up all of those joints as you roll down into it, which is different than hinging. Okay, you see that? Okay, so if I just let my head come forward, I'm hinging on this CT junction right here. This is where the thoracic spine meets the cervical spine, and so that's the part then. And you can see it. I'll show you. Watch that bone there. See what happened? How much motion occurs there? Yep, right in there. That's the spot. You can see. Yeah. And the cervical, the thoracic spine is more rigid because of the ribs. And so with the head back, it's relatively flat. Sure. Okay. And so that's the part then, it's like taking a bend in your finger back. The ligaments and the tissue, the fascial tissue that are in part stabilization are getting stretched and pulled, and then that starts to spread, and then there's where that stress strain problem comes in, and then spurs and stuff can occur because it's trying to resist and repair itself under that tension. So, any question? Any other questions?
What would you say are the best exercises to do when you first get up in the morning? Because I know, like myself, and I know other people have a tendency to get up and it's go right away.
Yeah.
What is something that you can do to take a couple of minutes to, I don't want to say set yourself up for success really, but to make sure that you're aligned properly before you hit the day?
One is try to sleep with just one pillow if possible, because again, positioning, if you've got two pillows or the big fluffy pillows that are holding your head in this position, that disc can creep through the night because you're relaxing, and now your pressure's on the front of the spine, and then it opens up the back. So depending on how you're sleeping, and then for side, I'm a side sleeper, so I use a pillow and then I bunch it up so that my head. So I kind of woke up one night a long time ago thinking about that just on the pillow, even just sleeping in that kind of fetal position, here you're in that forward head. So when I started thinking about it, I woke myself up in the middle of the night and realized I was here and brought my head back. Okay, so when I position myself to go to sleep, I try to position myself in alignment, in a sense. So that would be the thing. What are you feeling when you get up in the morning? If you're feeling tension in the muscles in the neck, and so if you're feeling tension back here, then I would work on those chin tucks, maybe a little of this here, where you're just starting to reverse that tension. Turning these on gives you reciprocal inhibition of these muscles, and then turns the dimmer switch down. Okay, and then maybe a little bit of the rolling, but just that nodding, and then shoulder stuff. Just that, whatever you feel, just gently get you moving. Okay, so they all it's kind of hard to say the best, because that's why I kind of open up with the sensory system, because your sensors are telling you what you need to kind of address at the moment. And that's what I really kind of go back to, is that present moment consciousness. Okay, what am I feeling right now? And then you would do the movement. So the alignment for sure is one of the big things. Just that can start your day, because now you're already putting yourself in alignment, and then you'll notice yourself out here later, and you just bring it back. Okay, and then play around with those little nods just to get things loosened up there. But I personally, I don't do as much of that myself in the morning, because I don't find the need to. Where I apply this stuff is throughout the day. Like I say, driving, working on the computer, doing documentation, you know, and you catch yourself out there and you're kind of, what the hell? Okay, we'll get the head back and just line it up. One other thing too, I'll just give you this tidbit, because this, you see, it's hard to section into the sections because it's all connected. Okay, so head, you know, head to toe. So one of the things then that I will be working on and showing in the core, or in the back one, is just engaging the six pack. Okay, we don't think about it, but the chair's the worst invention we come up with, because we stop squatting, we stop using the core muscles, and so everything's in front, we're using the back, and then when you sit down, you just lay into it, so you're not using the abdominals. So the simple motion of just leaning back just enough to where you feel your stomach turn on, and just stay there. It's amazing how effective that is for just developing the strength, and then you're just using it, and that's what it's for. The six pack is your bicep or the trunk. If this is then we use our hip flexors, which then hinge us again, similar to the sternocleidomastoid, and then that is putting more pressure and tension. Here's your hip flexor right here. It's compressing down through the spine, and again, compressing your vertebrae and your facet joints. So in the body, we get a lower cross pattern syndrome and an upper cross pattern syndrome, based on that reciprocal inhibition and muscles getting weak and muscles getting tight. So in here, we get tightness in the back of the neck, weakness in the front of the neck, tightness in the back of the shoulders, or in the pecs actually, and then weakness in the mid-back of the shoulders. Okay, so most everything we do is here, so we get weak in these muscles back here, right? And then this tension pulls the shoulders forward, and those ones are stretched out, and now that puts us out of alignment. So that's where I'm going to go with the shoulder class, because then I get into a lot more detail with what's going on in the shoulder, which then again ties into the neck, because it's all connected. And so, but for the neck portion of it, these are the things that I do all the time, and I teach all the time. It's just kind of what I put in there with the neck traction, the alignment first, and then your gentle stretches. I mean, I'll sit at a stoplight if it's, you know, I'll just tilt my head sideways and get a general stretch on there. If I need to, I might turn it a little bit more and isolate the upper trap, or go this way. Oh, levator scap doesn't feel good or bad. Upper trap feels a little tight, so I might stay there for a few seconds, and just, you see, you just play with it. It's no different than the unconscious movements that we do throughout the day. And it's those unconscious awareness that the tension builds, but we don't really address it, that lead to the long-term changes and problems that I see. And so that's kind of why I put this together, is that this is what I like to do. I don't like the documentation part. I like the teaching part and helping people. And I find for myself how effective it is on an ongoing basis, and how much I can still do, And like I say, I don't like headaches, and I don't get them very often, but if I do, that's the first thing I do, is go right up to that spot there and give a little press, and get my alignment back, and give myself a little traction, and 9 times out of 10, I put them out within. I never take aspirin. I don't take any medication whatsoever. I don't need
But
to.
then that's likely a muscle tension headache as opposed to the patient talking about having a migraine.
Right, right. But
Which is not to say they're not related.
yes, and because, if a person frequently gets tension headaches, then they start to think, well, this is a migraine, or it's been called, and so and there's a lot of, cross terminology there that we think of and associate. So, a true migraine generally has got the aura and all that different stuff in there. So, those ones then, but even there, sometimes that can be helped because, where is it coming from? I mean, if this is all bound up here, and we got our cranial nerves coming off this brainstem, and in this section, I mean, it's just this little conduit. I mean, look at it right there.
But
all
also
that's
could be
going on.
chemical in the
And chemicals, yeah,
sensitivity.
yeah, absolutely.
So in losing a bunch of the technical terms for the various muscles, if you're just moving your head around and you end up starting to look and say, okay, I'm finding something that's relatively tight, basically just go ahead and do some gentle pulling on that, because that will help loosen it up and help balance and keep you more flexible.
Most definitely. Yeah. Yeah.
Okay.
And that's definitely the simple version. And that's what I want you to walk away with, was that all the technical mumbo jumbo, I always throw it out, I had to learn it.
Okay.
And if you hear the word at least once, and if you ever wind up at the doctor and he's talking about it, like, well, I remember that PT guy saying something about that muscle. So it's but it's the movement.
Okay.
And
I'm
that's
still a little vague in terms of the difference between like just pulling the chin back the way you were talking versus having your head somehow where you're crushing him.
Yeah. So, now watch the relationship of my ear to my shoulder. Okay, so, and I'll go on the forward head. All right, so now, if I just kind of bring my head back, I try to just bring my head back, I mean, you can hear my voice is changing versus stack, kind of lift my head up. So you should see almost like a little slight change in the arc and distance. So here, it's going like a shortening, but here, you would notice it might stack. And
It's more like a combination of standing up straight and having then your chin brought down.
yeah, it's definitely standing up straight and bringing the ears back over the shoulder. And then see, because you have a bit of the curve right through here, okay, that then pushes your head farther from the wall. And so this is the spot that I was talking about, that for you over time, you can minimize that and potentially change the direction, okay? Because right now, it's starting to hold you in this position.
So starting.
Yeah. Well, that is true, but I like to be optimistic, all right? So as you keep playing with that, you'll start to bring that back. Now, another thing that is very fun and easy to do at night is when you lay down, try to lay down without a pillow at first and just let your head rest into the mattress. If that's uncomfortable, then use a little pillow to give you that bit of support. But you do your chin tuck, you press your head into the pillow, hold it for about a count of 5, and then relax. And then you press it back again, and relax. And then again, and relax. And then add a couple of those little nods. Not enough to gauge your sternum, but just those deep ones. And now you're turning on the neck flexor and get reciprocal inhibition. What I like about that, and I'll do that with people, I have them do that while I'm giving them manual traction with my hands. I just cup the base of the skull, and then I just give this little traction. But what's nice about it is contract, relax is a way to help relax the muscle, all right? And so when you're pushing your head in, you're contracting these muscles. And then when you relax, it goes into the relaxed phase. Those little myosin pods disconnect from the actin fibers, okay? And so now the muscles aren't holding my head up. So when I'm doing this, all my muscles are still kind of firing because they're stabilizing my head from flopping over, all right? Now your head is resting in my hands or on the pillow or on the mattress, so you push back into it and then you relax, push back and relax. So those muscles can start to relax a little bit more because now they're not holding your head. Now when you add that,
But it's freaking out your low back and hips.
what's that?
But it's freaking out your low back and hips and put your head back like that.
then you got to come to the back ones because it'll all tie together. But then when you do that reciprocal inhibition, now your brain is turning off innervation signal. You know, like think of it like a dimmer switch. It's on high, and you can turn that dimmer switch down. So instead of it sending all that signal into those muscles being tight and used to being tight because of the spindles, then when you turn on the neck flexors, your brain shuts down these a little bit and it helps them relax even that much further. And so a somatics term is sensory motor amnesia. Okay? We forget sometimes how a relaxed muscle is really supposed to feel. So like my bicep right now, it's nice and soft. Okay? But now when I tighten it, it's firmer, right? The back and the neck, because we're always using them, we crank up the volume in that tone. And then when we relax it, we might not relax it down to 10, 20, 30%. It might still be sitting at 50, 60% of contraction. But that's what we're used to, and that's too high. And so that's the stuff that doesn't allow your joints and stuff to open up and expand because that tension is still holding everything tight. And so part of what you're playing with in all this is recalibrating your system to feel good in alignment and aware when you're out of alignment. And then the same with the muscle tension. You know, tight muscles are normal, but tight, tender muscles, that's on the verge of being dysfunctional because they shouldn't be sore. Like right now, I'm rolling around on a couple because, again, using the hands and stuff, I mean, we're always tight. And so those are the ones that you want to kind of pay attention to. And so it's not tender, it's maybe a little uncomfortable, but it's not that bad. So I'm just doing some massage because that's another tool that I didn't mention to do for yourself. I mean, using a tennis ball or, like I say, using the knuckles. Sometimes I'll, put my fists underneath there and just let my head rest and just get that pressure right up in that suboccipital region there. The trigger point release, where you find the most tender point on the muscle and press on it until it starts to, you press, bring it up to about a 5 or 6, and when it starts to fade, then you press a little harder, bring it up to a 5 or 6, and right now I can feel that going down into my ring finger, and now it just faded out because I started moving it a little bit, and then you just back off of it. But that's a nice technique to release a muscle that's in somewhat of a mild spasm. Okay? And so those are the tools that I keep in the toolbox all the time, because that's how I just try to practice what I preach and keep this machine running. I got a lot of things I still want to do, and I don't like pain. You always have something that hurts a little, but it's not always. Yeah, see, right now I can say, just from moving around, there's nothing that is like really attracting my attention in an uncomfortable way. But I've had like my knuckle, if I press on it, this one is the only one I know I broke in the batting cage with my kids when the Grand Slam was open 20 years ago. Wow! I heard my son say, "Step up to the plate, Dad." And I stepped up and the ball went right out of my knuckle. And I dropped my hand and said, "Dad, what are you doing? I told you to step back from the plate." So anyways, I finally wound up, I was a PT by then and I was self-treating myself, and one of my colleagues said, "Have you had that looked at?" Because it was still pretty ugly looking, and she referred me to the hand therapist I was working with, and she told me to go get an x-ray, so I know that one was broken, but it's all functional. But the point is that there's a little knob that's starting to develop right here, and my mother has smashed her thumb. She tells me the story over and over at this point in life, in the old Rambler car door, and that thing is just bulbous, and it's because she didn't know how to control the swelling. And so what I do in that case, even right now, and it's tender to the touch, but I just keep kind of kneading and milking that fluid out of the joint, and I do my stretches from my thumb on a regular basis, and it's, it doesn't scream at me. This knuckle was bothering me, and even clicking and snapping from chainsawing a couple of heavy days before Christmas there. And so that too, working on doing these palm stretches and working on my individual stretches and just troubleshoot that spot until it's not bugging me right now. And so that's what you want to do. Just
Your thumb's just hereditary.
thumbs are hereditary.
You said your mother has that same thumb.
She did. I'm not going to buy into that one. Some genes are meant not to be expressed. So anyways, did you find that helpful?
Sure.
Any questions? All right. And all the handout, the exercises, most of them that I talked about are in here. And feel free if you come back to any of the other sessions and you have a question.
There'll be different handouts.
Yeah, there will be. Different handout. A little bit for every spot.
You gentlemen want to hold on? I'm going to go grab your gift cards and I'll be right back.
Yeah, this is a cool book. Have you ever seen the book The Anatomy Trains?
No.
This guy is Thomas Myers, and he was a Rolfer. Have you heard of Rolfing? Rolfing is that really deep tissue fascia release, and then he was an anatomist and had access to a cadaver lab, and he would do cadaver dissections, and he literally found that there's a continuous connection from the fascia and muscles in the bottom of the foot up through your Achilles tendon, through the calf, into the knee, your hamstring, up through the sacrotuberous ligament that runs through here, up your back strap, neck, over the top of the head, right to the top of the eyebrows. Okay, he called that the superficial back line. And then this is the superficial front line. And look at what muscles involved right there. That six pack. Okay. So